Hello everyone, welcome to my YouTube channel Nursing Education. So today I'm going to do quick review of Placenta Previa versus Abruptio Placenta. Placenta Previa and Placenta Abruptio are both pregnancy conditions that can cause vaginal bleeding and occur after about 20 weeks of gestation. Placenta Previa is when the placenta implant very close to or over the cervix. And Abruptio placenta or placental abruptio is when the placenta detaches from the implantation. So basically Placenta Previa and Abruptio placenta is a type of antepartum hemorrhage which occur during the pregnancy. So Placenta Previa is where the placenta is implanted partially or completely over the lower uterine segment, which is dependent upon the type of Placenta Previa. So basically there are four types of Placenta Previa: low-lying, marginal, incomplete or partial central, and the central or total Placenta Previa. So complication and outcome of the pregnancy is depend upon the type of the Placenta Previa. If the Placenta Previa is low-lying, where the major part of the placenta is attached to the upper segment of uterus and only the lower marginal invade the lower uterine segment, which make possible for the normal delivery and the less complication than the complete or total Placenta Previa. In the complete or total Placenta Previa, the placenta is covered the internal os even after it is fully dilated, which make impossible for the normal delivery, and the person has to go for the cesarean section, which further cause the complication and risk for the woman and baby. So the low-lying Placenta Previa is less risky than the complete or total Placenta Previa. Another is Abruptio Placenta. So Abruptio Placenta is bleeding occurred due to the premature separation of normally situated placenta. In the Placenta Previa, the placenta is implanted on the lower uterine segment, whereas in the Abruptio Placenta, the placenta is normally situated in the uterus, which is a premature separate. Normally, placenta is separated after the delivery of the fetus or baby. In the third stage of labor, the normally placenta is separated and which has to separate and come out of the uterus. But in the Abruptio Placenta, the placenta separate prematurely before the delivery of the baby, which put the woman and the baby at risk. The clinical feature of the Placenta Previa, the nature of the bleeding is always revealed, whereas in the Abruptio Placenta can be revealed or concealed, can be seen outside or can be hiding behind the separated placenta. In the Placenta Previa, the bleeding is always revealed, is painless, causeless, or bleeding can be recurrent. In the Abruptio Placenta, the bleeding is painful and often attributed to preeclampsia or due to any trauma and continuous. Abruptio Placenta can be revealed or concealed or usually mixed. So revealed Abruptio Placenta is where the blood comes out of the cervical canal to the visibly externally, where you can see the blood outside of the cervix. Whereas in the concealed type, the blood collected behind the separated placenta and blood is not visible outside. And in the mix, some blood can be visibly outside or some of them can be hiding behind the separated placenta. Character of the blood in the Placenta Previa is bright red color. In the Abruptio Placenta is dark red color. General condition and anemia in the Placenta Previa is proportionate to the visible blood loss. The amount of blood loss is causing anemia and the general condition is dependent. But in the Abruptio Placenta, reveal is okay, where you can see the blood and based on the amount of visible blood, you can analyze the chances of having anemia and general condition. But in the type of conceal or mixed, this is out of proportion. Feature of the preeclampsia in the placenta previa is not relevant, whereas in the abruptio placenta is presented in 1/3 of the cases. Abdominal examination, height of uterus is proportionated height to the gestational age in the placenta previa. In the abruptio placenta, especially in the concealed type of abruptio placenta, the blood is hiding behind the separated placenta, which make uterus to be enlarged. Uterus can be feel soft and relaxed in the placenta previa, whereas in the abruptio placenta, it may be tense, tender, and rigid. Malpresentation is common in the placenta previa. This happens when the placenta abnormal position prevents the fetus from establishing a normal polarity. In the placenta previa, the placenta is situated in the lower uterine segment, which prevent head of the fetus to be engaged, and the head is high floating, which is undilated in the abruptio placenta, and head may be engaged. Fetal heart rate is usually present in the placenta previa. In the abruptio placenta, especially in the concealed type, it is absent. As the blood is not revealing outside, it is hard to diagnose the abruptio placenta, and as the placenta separate from the uterus, the oxygen supply from the mother to the fetus is cut off and the baby can die. The placentography and the ultrasound. When you do the ultrasound, the placenta can be shown in the lower segment of uterus in the placenta previa, and in the abruptio placenta, the placenta is normally situated, which is in the upper segment. The vaginal examination should not be done in the placenta previa, but if you do, the placenta is felt on the lower segment. And in the abruptio placenta, placenta is not felt on the lower segment, and blood clots should not be confused with the placenta.